Okay, now we're gonna start with our head to toe assessment after we've come in, taken in the room, explained what we're doing, and we have done our vital signs. Now we're gonna start doing like a general survey and our head to toe assessment. So looking at Rose, I can tell that her skin is nice and tan. She does not look discolored, jaundiced, pale, or cyanotic. I look at her eyes. Her eyes are nice and clear. Her sclera are nice and pearly white. She does not have any eye discharge, right? So her eyes are nice and clear, no discharge. If we were able to see underneath her mask, we would note that she does not have any flaring of the nostrils. Her lips are nice and moist, and she does not have dry mucous membranes. At that point, you can also tell if Rose has halitosis or if she would maybe just need a morning freshening up with a toothbrush. So we can do that assessment nice and easy without even much contact with her. Now also, as we are working on the head, we are going to go ahead and check Rose's eyes for perla. So we are going to need a pen light. Miss Rose, I'm going to look into your eyes with a flashlight. I'm going to kind of shade your eyes with my hand. I'm going to have you look at my nose, and I'm going to bring the light in twice to the left eye and twice to the right eye. I'm just checking to make sure that your pupils are going to shrink and then re-expand, and that just means you have normal function of your pupils, and it has to do with your cranial nerves. Okay, so I'm going to have you look right here at me. Here comes the light into your left eye. Okay, I just looked at the left eye. I wanted to make sure that it constricted. I bring it in a second time. I have now looked at her right eye to make sure that eye also constricted, even though the light came in to the left eye. So they should be working simultaneously, even without stimulation from the light. We're going to do the same thing to your right eye. Looking at her right eye. Looking at her left eye. Everything looks great. Thank you so much.
You're welcome. Thank you.
So we have now done our basic assessment of the head. We're now going to come down to her chest region. Now we are noticing if her respirations are nice and easy, or if she is struggling to breathe, if she is kind of heaving and working hard to breathe. Her respirations are nice and easy. So per the lecture, there's 8 locations on the front and 8 locations on the back that you should be auscultating. Remember, there's 3 lobes on the right, 2 lobes on the left, because the heart takes the place of the 3rd lobe. Most secretions will settle to the posterior bases due to gravity. So if you're going to hear adventitious lung sounds, it will be posteriorly. But you still need to do a full assessment. So if Rose had on a nightshirt, we would be going stethoscope to skin contact for an accurate assessment. We would start right to left, left to right. It would not matter. We're going to go 1, 2, having her take nice deep breaths. 3, 4, 5, 6, and then we're going to come lateral, and we're going to do 7, 8. Now Rose is going to be able to sit forward for me, and we're going to go ahead and auscultate her back. Since your scapula actually come into the middle portion of your spine area, you're going to assess like an Under Armour sign, which is the H, which goes like this. So we're going to start here up at the top, go right, left, come in so that we are not on top of the scapula, go down next to the scapula, and then kind of out to the external areas. So again, 1, 2, going in towards the spine, 3, 4, 5, 6, and then coming out laterally, 7, 8. And as we've done that, Rose has taken nice, deep, slow breaths for us, and we have done that procedure. We have done it skin to stethoscope. So we've now assessed the lungs. I'm now going to come out to her extremities, and we're going to do some strength tests. We already have checked her capillary refill because we did that when we did our pulse oximeter reading. So we know she has good cap refill. I'm going to check to see if she has any tenting. That checks for dehydration. Her skin is nice and taut. I'm going to have her do some strength tests so we can see if she has equal strength on each side. Miss Rose, will you squeeze my fingers for me as hard as you can? Okay, that's great. Another strength test you could do is say, Miss Rose, will you raise your arm against my hand? Okay. Will you push down against my hand? And Will you raise against my hand? Will you push down against my hand? All right, so we're checking her strength inequality by having her do those activities. So we know that she can follow direction, right? So she followed whatever I told her to do. So now we're also working on her motor coordination. Now we're going to the abdomen. Abdomen is broken into 4 pieces, right? You have a left lower, a right lower, a left upper, and a right upper. Is there a best way to do an assessment? Yes, there is. So as we've talked about before, your large intestine is like the picture frame for the small intestine. It goes around the exterior with the small intestines in the center. Your right lower quadrant is where your small intestines and your large intestines attach. So I start right lower quadrant, right upper, left lower, and that's how I do my assessment. So skin to skin, again, you're going to do an assessment of the abdomen. Make sure that your diaphragm is on, and you're going to listen to each location until you hear pops, gurgles, or noises, letting us know that there is bowel sounds present. You cannot document that there is no bowel sounds unless you have auscultated for 5 minutes in every single quadrant. Then you would need to contact the physician if we said that there was no bowel sounds. All right, so right lower, right upper, left lower would be how you would auscultate. While you're auscultating, you're noticing if the abdomen is distended or soft to touch. We're not worrying about palpation and percussion at this point in time. While we're in the abdomen, we now have noticed if she does or does not have a urinary catheter. We've noticed if she has a peri product on because she has incontinence. We also can be inspecting the tissues down in this area in her folds or in her groin because we are there. So we know she doesn't have a catheter. She has no stress incontinent issues. We asked her, she needed to go to the restroom when we first started, and she said that she had already been up and used the bathroom. So now we can continue on. So now we're going to come down the legs and do our assessments distally. So we are checking to see if she has edema. If you remember, edema is categorized in +1, +2, +3, or +4. +1 is a pitting that returns immediately. A +2 returns in about 6 seconds. A +3 is 12 seconds, and +4 is a minimum of 20 seconds and can be significantly longer for the tissue to rebound to its natural setting position. So I'm pushing right over the shin bone, gentle pressure, and seeing if there's any dimpling of the skin. There's no dimpling, but I have noticed that she has great capillary refill, 3 seconds or less, just by putting pressure on her ankles. I'm going to go ahead and check for her pedal pulses, dorsalis pedis, which is on the top portion of the foot, kind of along the same line as the great toe. And then I'm also feeling for the posterior tibial pulse, which is behind the malleolus area. And she has great pulses. So we can also do strength testing here. We can have her pull her feet back, push against me like a gas pedal. So pull back for me and push. Okay, same thing can apply. Please lift your leg into my hand. Please pull your leg down. Please push your leg against my hand. Please pull down. So we've checked her movement, her ability to follow directions, and don't forget the heels. This is a place where pressure ulcers can develop very quickly. So we're inspecting the heel to make sure that there's no redness or non-blanchable area. Pause.